I'd like to go ahead and discuss some of the myths, truths and falsehoods about laparoscopic, conventional, robotic-assisted, vaginal, and abdominal surgeries. Vaginal and conventional laparoscopy has limitations compared to robotic-assisted laparoscopy. This is true in complex cases when the uterus is large or there are multiple prior surgeries and there's adhesions. Vaginal surgery in conventional laparoscopy is difficult to perform. Imagine it this way. A large uterus trying to be taken out through the vaginal vault is like working through a muffler. You can't get to it. And doing it laparoscopically, your limitations are both for vaginal and conventional laparoscopy. You can't see up through the hole that you're working in because you're working at a distance. Laparoscopically, it can be technically challenging because you can't see around the masses as you're working down with straight. It's like working with straight sticks. You don't have the flexibility or the manual dexterity that you would have in robotics. There's unparalleled manual dexterity and precision when you work with robotics. And you can move the camera all the way down into the pelvis, look backwards, look up, look down. You're working in 3D. So the visualization is far superior with robotic assisted than either one of the other two. So unless the uterus is right there and hanging out in a vaginal surgery, it's very difficult with large uteruses to manipulate or visualize with the surgeries you're doing. And the same with laparoscopic. It can be very challenging or frustrating for a surgeon to go around a uterus and manipulate it to be able to visualize everything that you want to possibly see. Conventional laparoscopy has less complications over robotic-assisted laparoscopy. This is false. At best, in the best hands with a laparoscopic, advanced laparoscopic surgeon, perhaps they're equal. But in the majority of cases, there are reduced complications in robotic-assisted surgeries for complex cases in general as you oversee what kinds of cases are being performed and what the overall complication rate is. Patients recover faster, have less pain, and go to work sooner with conventional laparoscopy and vaginal hysterectomies as compared to robotic-assisted laparoscopic surgeries. This is also false. It has been shown that there is less pain with robotic-assisted surgeries. One of the technologies are that in the process of the laparoscopic technique with robotics, there's a pivotal system at the area where the skin is, where the trocars, the actual ports that hold the instruments, go into the patient. So it's on a pivotal system as opposed to a pulling it forward and backwards, which causes less trauma and less damage to the areas on the skin. So patients do have less pain than conventional laparoscopy in robotics. And then with vaginal hysterectomies, you're basically pulling, and so it's the pulling sensation of pulling things down that causes more pain. So patients commonly go home the same day, and my patients go home the same day. The length of stay has been shown to be less with robotics over laparoscopic and definitely over vaginal in general. And as far as going back to work or returning to things that they do, robotics has shown that patients go home. My patients go home same day, go back to work in a matter of days. So there is no benefit to conventional over robotic or vaginal. The high cost of robotics should stop its use. This is a common falsehood. It's definitely false. Certainly it goes back to a proficient surgeon, an efficient OR team, and also looking at what kinds of complications, how long does a patient stay in the hospital? Are they readmitted? If you look at the full picture, the cost is not higher. When measuring quality outcomes, which I know insurance companies love to do, robotic-assisted hysterectomies has less blood loss, shorter hospital stays, less readmissions to the hospital for complications as compared to conventional laparoscopic, vaginal, and open surgeries. This is true. So ultimately, there's less blood loss with robotics. The hospital stay is shorter. Patients go home. There's less readmissions within a 30-day window, which is what we track to be able to see what kind of things can be attributed to the surgery, what could possibly be a bad outcome. So there's less of that compared to the other types of surgery, such as conventional laparoscopy, vaginal, and open surgeries.